This is a reading of Heart Surgery Safety Guide from Consumer Reports. Every year, hundreds of thousands of Americans undergo heart surgery. Though these operations are becoming safer, when something goes wrong, it can be catastrophic. Follow these strategies and use our hospital ratings to make the best, most informed choices for you and your loved ones. The actor Bill Paxton entered Cedars-Sinai Medical Center in Los Angeles last February for surgery to fix a faulty heart valve and a bulge in a major artery. But after 11 days, Paxton, then 61, died. Now in a lawsuit against the surgeon and the hospital, his family alleges that his death stemmed not from the underlying heart problems, but from complications linked to the procedures meant to correct them. The lawsuit also claims that the surgery wasn't necessary and that the surgeon used a maverick technique, failed to disclose potential risk, and left the operating room too soon, leading to delays in treating those complications. A spokesman from Cedars-Sinai said it could not comment on Paxton's case due to patient privacy. While only a small percentage of heart surgery patients died during the operation, all put their lives in the hands of the surgeon and the hospital. Indeed, as Paxton's lawyers wrote in the lawsuit, there's a power imbalance between doctors who are learned, skilled, and experienced in medical procedures and conditions, and patients and their families who know little or nothing about the operation. With our guide for heart surgery patients, you can begin to right that imbalance, to learn when to ask hard questions, what to anticipate, and what to guard against. And you can use our ratings to choose a hospital with a proven record of success. Knowledge is powerful. Open heart surgery is no small matter. Surgeons often saw through the breastbone to open the chest, connect the patient to a heart-lung machine, stop the heart, then repair it. Despite the complexity, doctors performed more than 200,000 such procedures in the United States in 2015. From experienced surgeons, the procedures can sometimes seem almost routine. But for patients and their families, the prospect of heart surgery can be scary. When Sharon Greenberg, an attorney in Chicago, learned that she needed a heart valve replaced, she decided to face that fear head on. She learned as much as she could about the procedure, researching it extensively and peppering her surgeon with questions. All that helped calm her nerves. I was much better off knowing what was in store for me than worrying about what could happen, Greenberg said. Insist on an open exchange. When you're considering heart surgery, nothing about the operation should be a mystery. The biggest fear patients have is of the unknown, says Susan Fredericks, Ph.D., graduate program director in the School of Nursing at Ryerson University in Toronto, who has conducted extensive research on cardiac care. At her hospital, patients can see where they will have surgery and where they will recover and connect with former patients, she said. Doctors should also discuss the potential benefits of the surgery, but be honest about the risks too, so patients can make fully informed decisions. The Society of Thoracic Surgeons, STS, the main professional group that represents heart surgeons, provided Consumer Reports with the data used in our heart hospital ratings and has a risk calculator at riskcalc.sts.org. riskcalc.sts.org. Use it with your doctor's help and ask him or her to carefully review the results with you. From her research, Greenberg was prepared to face the post-op pain, which actually proved reassuring. When waking up from surgery, she remembers thinking with relief, well, I can't be dead because I'm in terrible pain. Most important, she knew that her pain would soon diminish and that in time she would be stronger, with the prospect of many vigorous years ahead. 5 common heart procedures. 1. Coronary artery bypass grafting, CABG. Plaque that grows in the heart's arteries can prevent the organ from getting enough oxygen-rich blood. To fix the problem, a surgeon takes healthy sections of a vein or artery from your leg or chest wall and uses them to bypass blockages in up to 4 arteries. 2. Percutaneous coronary intervention, PCI. Sometimes doctors use this less invasive procedure to treat blockages by inserting and inflating a tiny balloon in an artery, often propping it open with a stent. 3. Aortic valve replacement, AVR. The aortic valve is designed to open as the heart pumps, allowing blood out, and to close between beats, preventing blood from flowing back in. But some people are born with a faulty valve or develop one over time. Surgeons can repair a bad valve or replace it with a mechanical one or one made from human or animal tissue. When the AVR is too risky, surgeons can perform transcatheter aortic valve replacement, TAVR, a less invasive but less proven surgery that is performed through a catheter inserted in the leg or groin and threaded up to the heart. Aneurysm repair. When an artery wall weakens and begins to bulge, surgeons can patch or bypass the weakened part before it bursts. 5. Arrhythmia treatment. A heart that beats too slowly, too quickly, or irregularly is sometimes controlled with one of two permanently implanted devices. A pacemaker uses electric impulses to regulate the heartbeat. An implantable cardioverter defibrillator, ICD, shocks the heart when it detects a dangerous rhythm, resyncing it. In rare cases, rhythm disorders must be corrected through an open heart surgery known as Mays procedure, which reroutes the electrical pathways in the heart. Hospitals that don't share data. Of the more than 1,000 U.S. hospitals that do adult heart surgery, about 65% share their mortality and complication rates with Consumer Reports or the Society of Thoracic Surgeons, STS, a professional group for heart surgeons. Last year, 30 large hospitals didn't share that data with CR or STS. This year, 12 didn't. Those 12 that didn't are Arkansas Heart Hospital in Little Rock, Baptist Memorial Hospital, Memphis, Tennessee, Forest General Hospital, Hattiesburg, Mississippi, Kansas Heart Hospital in Wichita, Leesburg Regional Medical Center in Florida, Methodist Hospital in San Antonio, Mount Sinai Medical Center in Miami Beach, Florida, New Hanover Regional Medical Center in Wilmington, North Carolina, Ohio Health Riverside Methodist Hospital in Columbus, Providence Sacred Heart Medical Center and Children's Hospital in Spokane, Washington, St. Francis Hospital and Medical Center in Hartford, Connecticut, St. Vincent Medical Center, Riverside, Jacksonville, Florida. A few hospitals, including Cedars-Sinai Medical Center in Los Angeles and New York Presbyterian Hospital in New York City, allow STS to publish their heart data, but not Consumer Reports. You can look up their ratings at publicreportingsts.org. Have an open dialogue. Patients should feel comfortable asking tough questions. 3 questions to ask before you have heart surgery. Do I really need this operation? When your cardiologist says you need heart surgery, you might hesitate to question his or her judgment, but asking tough questions is important because the stakes are so high, says Rita Redberg, MD, a cardiologist and editor of JAMA Internal Medicine. The first thing to know is that there may be more time than you realize to make a decision. Unless you've just had a life-threatening symptom, heart surgery rarely needs to be done immediately, so you have time to think through options and make informed choices, Redberg says. And with heart disease, you often do have choices, says Young Shin, MD, who heads the cardiothoracic surgery department at the Kaiser Sunnyside Medical Center in Clackamas, Oregon, one of only 18 hospitals across the country that earn top scores in CR's ratings of both bypass and valve replacement surgery. For example, heart disease symptoms such as chest pain and shortness of breath can sometimes be treated not just through bypass surgery, but also with a less invasive procedure known as percutaneous coronary intervention, PCI. That technique involves inflating a tiny balloon in a clogged artery to widen the blockage, often leaving a metal stent behind to prop it open. In other cases, heart disease can be controlled with a combination of blood pressure, cholesterol, and other drugs. Talk with your doctors, your cardiologist, as well as your surgeon about those options. Also, be sure to consider how the surgery will affect your quality of life. For example, possibly extending life by 20 years with bypass surgery might be less important to someone in their 80s than to a younger person. An older person might opt for the easier recovery of angioplasty or even just stick with meds. The decision is rarely black and white, Shin says. Most of the time, we're in the gray zone, which makes patient preferences especially important. How do I choose a hospital and surgeon? First, check the hospital ratings on the following pages, which are based on such factors as survival and complication rates. The data are provided to us by the Society of Thoracic Surgeons, the professional group that represents heart surgeons. The ratings cover the two most common types of heart surgery, bypass and valve replacement, and reflect how well an entire surgical team works together, says David Shehanan, MD, Vice President of the Center for Quality and Safety at Massachusetts General Hospital, who oversees the STS data. If a hospital you're considering has a low rating, ask your surgeon why, how well it did in the past, and what it's doing now to improve. And if the hospital doesn't appear in our ratings, ask what percentage of its patients die within 30 days of the surgery or have serious complications, such as developing a chest infection. If he or she won't share that information, consider looking for another hospital and another surgeon, Shahanan says. Unless your procedure is urgent, try to visit at least 2 hospitals and meet with more than one surgeon before you make up your mind. How to find the best possible surgeon? You can look up our ratings of surgical groups at cr.org/heart surgeons. For a specific surgeon, ask directly about his or her mortality and complication rates, says Sarah Perenia, MD, a cardiothoracic surgeon at the University of Alabama at Birmingham Health Systems, a top-rated heart hospital. Also ask about experience. While there's no set number of procedures a surgeon should have done, you don't want to be among the first. If a doctor won't answer these questions, that's a red flag. What happens after the procedure? Knowing what to expect after surgery can make your recovery go more smoothly. Most patients stay in the ICU for one night, Pereira says. As you're emerging from anesthesia, you might be given a sedative so that you're calm when you wake up and while the staff removes your breathing tube, which can be unsettling. Expect the first few days to be uncomfortable. Even breathing can hurt when you have a temporary drainage tubes in your chest and your surgical wound is healing. But within the first 24 hours, hospital staff will encourage you to get up and move around. And after 4 or 5 days, most patients are ready to go home. To make sure everyone is on the same page, it's important that your surgeon or the hospital's discharge planner get in touch with your cardiologist and your primary care provider. And that should happen before you leave the hospital, Shahanan said. Those doctors who will care for you once you get home should know how the operation went and be aware of any special steps you may need to take during your recovery. You or someone caring for you should ask about any special equipment you might need when you get home, such as a shower chair and special dietary requirements. And be sure that you leave the hospital with prescriptions for all the medications you'll need, often including low-dose aspirin to prevent blood clots, a blood pressure drug, and a cholesterol-lowering statin drug, all of which you'll probably take indefinitely. To manage post-surgery discomfort, you should expect a short-term prescription for a pain reliever, though after a few days you should be able to manage with an over-the-counter one. Over the next 6 to 8 weeks, you'll be asked to gradually increase how much you walk each day until you're strong enough to begin cardiac rehab. These carefully supervised exercise programs, which are designed to rebuild muscle strength and aerobic fitness, have been found to extend lives after bypass surgery. The psychological effects of the surgery, fears that something else will happen to your heart as well as post-op depression, can last longer than the physical effects. But Perenia says that enrolling in cardiac rehab and knowing that your heart is working better than before the operation can help the fear subside. Safer heart surgery. Mortality rates during heart surgery from 1990 to 2016. In 1990, the mortality rates were 3.9. In 2016, the mortality rates were 2.1. The percentage of people who died during or soon after heart bypass surgery, the most common heart surgery in the U.S., has been cut nearly in half since 1990. This improvement is even more impressive given that patients today are having heart surgery at an older age. Ratings. Surgery success. Below are hospitals that share their data with Consumer Reports and did well in both heart bypass and aortic valve replacement in terms of complications, mortality, and other factors. Hospitals with top scores for both are listed first. For ratings of more than 500 hospitals nationwide, go to cr.org/hospital ratings. I am not going to read the entire list as it's rather long, but you can find it at cr.org/hospital ratings. How we rate hospitals. The data come from the Society of Thoracic Surgeons for hospitals that have agreed to share their information with us. Coronary artery bypass surgery. This rating reflects a hospital's performance in isolated coronary artery bypass graft surgery between July 2016 and June 2017. The rating is a composite of 4 measures. Survival, percentage of patients who leave a hospital and survive at least 30 days after surgery. Complications, percentage of patients who avoid the most serious complications, including needing a second operation, developing a deep chest infection, suffering a stroke or kidney failure, and requiring prolonged ventilation. Best surgical technique, percentage of patients who receive at least one graft from an internal mammary artery located under the breastbone, which improves survival. And the right drugs, percentage of patients who receive beta blockers before and after surgery to control blood pressure and heart rhythm, aspirin or similar drugs to prevent blood clots, and a drug to lower cholesterol. Aortic valve replacement surgery. This rating reflects a hospital's performance in surgical aortic valve replacement between July 2014 and June 2017. It doesn't include data for a newer procedure, transcatheter aortic valve replacement. The valve replacement rating is a composite of two measures, survival and complications. For details, go to cr.org/how-we-rate-hospitals. This reading of Consumer Reports Heart Surgery Safety Guide is brought to you by Women's First OBGYN, bringing you health news that you can use. Women's First is located at 817 Greenbrier Parkway in Chesapeake, Virginia, 23320. Our phone number is 757-267-9566. Women's First wants to remind you that the exact same inquiries and second opinions that you should get when you are considering getting heart surgery are the same when you are considering getting weight loss surgery or any type of procedure. Women's First offers Smart Lipo Triplex, Sculpture, Cellulite, and other aesthetic treatments. Call now for your consultation so that you can be fully informed when you make your beauty treatment procedure decision. Thank you for listening.